Attention! If you or a loved one has been diagnosed with Erb's palsy, you may be entitled to physical therapy intervention. Erb's palsy is a type of obstetric brachial plexus disorder, most commonly by dystocia, which is known as abnormally troublesome childbirth. Troublesome childbirth can include moments where certain body positions of the infant results in the overstretching of their brachial plexus, either from excessive pulling on the infant's shoulders during head-first delivery, pressure on the infant's arms, or clavicle fracture. The specific nerves within the upper brachial plexus potentially affected by these injuries include the axillary, musculocutaneous, or the suprascapular nerves. Any trauma to these nerves could result in dramatic upper body muscle weakness or loss of function. The risk factors of developing Erb's palsy are high infant birth weight, infants in the breech position, small or obese maternal size, vacuum extraction, gestational diabetes, or second-stage labor surpassing 60 minutes. Please be aware and seek medical attention if your child presents any of these signs or symptoms. Affected upper extremity has a permanent bend at the elbow and held against the body, partial or full paralysis, decreased or full loss of sensory or motor function, numbness of the affected limb, or damage to the circulatory, muscular, or nervous system development. Activity restrictions could be a result from these signs or symptoms. The course of this disorder depends upon the severity of the injury. 70 to 80% of cases heal within 1 year if they take the proper precaution and attend consistent treatment sessions. The bottom line is, the earlier the detection and treatment, the more successful the outcome. Some effects from severe Erb's palsy can be permanent. Surgery is a common intervention used for major nerve injuries to potentially restore upper extremity function. Doctors prefer to do this within 3 to 6 months following birth unless recommended otherwise. Goals during operation may include nerve graft transplant, nerve decompression, and scar tissue removal from neuromas. Non-surgical interventions such as Botox injections, electrical stimulation, and physical therapy are used for mild nerve injuries. The goals for physical therapy are to improve strength, flexibility, and neurological components for affected upper extremity. Hydrotherapy, sensory stimulation, and gentle massage are ways to improve patient limitations and achieve pain management goals. Home exercise programs are given to encourage home activity, and parents are highly encouraged to do the home exercise program with their child. Patients with Erb's palsy are prone to have delicate joints, muscle imbalances, and finger mutilations. The physical therapist or physical therapist assistant need to be cautious not to overstretch muscles and joints to prevent dislocation or further joint abnormalities. Also be aware of cutaneous infections that may be a result of mutilations. Again, attention, if any of you know anyone suffering from Erb's palsy, please take appropriate precaution and call 1-899-ERBS. That's 1-899-ERBS.